All right, you guys, this is Dave Mac 6, and we are back with the doc. Hey, Dr. Ren, so good to see you, man. It's been a while.
I know it's been a while. Good to be back, though.
Hey, so awesome, so awesome. We've been busy. Dr. Ren is a very busy guy, guys, so we thank you for being patient and
Both
for
have been busy.
keep sending questions, and we know you love the show. And so we're back right now. We're going to start with question number 1 for Dr. Ren. This is from my actually personal friend, Carrie. So I'm going to mention her by name because she's a big fan of the show. And she says, first, I love this segment. Dr. Ren is amazing, and I totally have a crush on him. Laugh out loud. And she is cute, Dr. Ren. This is a 2-part question. So a little background on the person asking the question. Former high-level pro competitor who throughout her career was on the conservative side of supplementation, Anavar, Primobolan, Clan T3 anti-estrogen, not all at once, but the compounds have been used. This woman has always been concerned with staying feminine and not collecting side effects, which is good. So part 1 of the question: if this woman were going to choose TRT supplementation for aesthetic and optimal healthy feeling purposes, not talking about contest shape, but also knowing this person may have a higher bar set for aesthetic than the average woman, what are some of the do's and don't or overall advice you would give to her?
Good question. One of the issues I have with a lot of former bodybuilders is they've already used something that is going to be more powerful than standard testosterone replacement therapy. We're all talking about steroids here from the word cholesterol. But the anabolic steroids, the testosterone molecules that have been adjusted to give you more of an anabolic effect, are certainly more powerful, obviously, than just regular testosterone. A 1-to-1 ratio is given to testosterone for anabolic versus androgenic benefits, if you will, or side effects, if you will. Something like Anavar is probably closer to a 3-to-1. So she's going to get much more gains in terms of the muscle department, of course doing the other 3 things right, eating right, sleeping right, and training right, than she would if she were to just take testosterone replacement therapy in the standard dose. So one question I get is, so first of all, I come up against this just doesn't feel the same. Well, yeah, it's not the same. I mean, this will bring you back, TRT will, to the levels you had when you were, say, 20 years old. That's the intent, is to rejuvenate, if you will, or fight back time. Yeah, turn back the clock. So you're not going to get the same benefits as an anabolic. But the other question I get is, well, what if I just do more? And the whole thing about there's a certain number of receptors, and you're only going to get so much juice for the squeeze. There's that S curve of diminishing returns. So yeah, I mean, you can use a higher than typical dose only because. Well, not only, but a lot of the reason because you'll feel more like you did on an anabolic with a supra-physiologic dose. And I'm not talking about a huge difference, but sometimes the standard with females, I'll use with the excipient that I typically use, a 20 milligram per ml strength. And some of the bodybuilders may say that even if they're normal absorbers, I just don't feel all that much out of this, and we'll go to 30 milligrams, something like that. And the labs will keep them a little bit higher than normal. Remember, we're talking about a cream now for a longer period of time, but because it's a cream, they're not going to be super physiologic for the whole week, and they'll feel better. I'm not sure if I'm giving the answer she's looking for. One of the other options with TRT, of course, is injectable. With injectable, just like injectable for men, you're going to be super physiologic for part of the week. That's just the nature of things. This is a big problem we have with doctors that are getting into this. Is they'll see a dose that's higher than typical, and have a cow. Whereas if it were, say, thyroid replacement therapy, they would simply say, well, when was your last dose taken? Oh, no wonder your T3 is twice normal. Well, yeah, doc, I took the thyroid 3 hours before the test. The whole idea of injectable, an esterified form of testosterone is ease of use, right? So you're going to have this peak and a trough during the week, but again, the mean for the week should be similar to the mean for the week using creams, although it really doesn't work out that way. Just the metabolism of an ester is just much different, too different to compare. But my point being that I think people who certainly have had a background in bodybuilding do better with the injectables, just because, I mean, there's a reason why you have to put on the cream. You're going to go up and down every day. This will keep your levels high for the week without having the daily peaks and valleys. And again, the average should be on the high end of normal. And I think we've talked about this before. For a female, in order to get the clinical benefits, you're going to have to go much higher than normal, certainly for the total serum, to get a free that approximates something where you're going to get clinical benefit. So again, for her, it's going to feel different, obviously, going from bodybuilder type dosages to just plain old human dosages. But you know, the other part of her question, I think, is about avoiding some of the side effects. Certainly you don't have to worry about the androgenicity as much, and well, I mean, that sums it up. I mean, the facial hair, the enlarged clitoris, the you know, the difference in the skin texture, all those things are mitigated. Yeah, the voice, sorry, the thickening of the vocal cords, that's another big one. That won't be as much of a worry, although, you know, you always, as a female, have to watch out for those things. Men too, but with men, you know, we don't care as much if we have a deeper voice. But with the females, you know, it's an issue. It's a big deal. Despite what was it, the Chinese swimming team that said, do you remember that?
No.
We can cut this part, but they asked, you know, they were setting records at some point. I don't remember what Olympics this was, and it was probably back in the 80s before we had testing down that well. But the comment, the punchline was, yeah, well, we're not coaching singers, we're coaching swimmers.
I knew you were going to go there. Okay, she's getting part two to her question. So part two, this woman is also in her early to mid 40. As she moves towards pre-menopause / menopause, what advice would you offer to help her stay in great shape and to feel good as long as possible?
Well, that's kind of an open-ended one. I mean, obviously, keep doing all the things you've been doing to this point to stay in shape. I mean, I try and let everybody know when they come into my office that all the things that I can do for you really are down here compared to what we all know is the real brass ring of this is exercise. Yeah. Now, obviously, the three pillars I always refer to about, you know, proper amount of sleep, proper amount of exercise, and proper diet still have to be included. But where I can come in handy oftentimes is during perimenopause or full-on menopause, which are just, you know, terms that imply your hormones have started to drop off to a point where you feel a difference. Yeah. We can leverage those things by restoring your levels of testosterone and some of the other hormones back to what they were when you were 20. Yeah. So no changes really are required on her part. You know, keep doing what I presume that, you know, she is still doing, which is exercising and eating right and sleeping right. Yeah. But if she's feeling like she lost a half step, well, then let's get the hormones back to where they were and leverage all those good habits again. And there aren't any real special tricks to it, although aging in general is different at, you know, 25 than it is at, you know, 50 something. You know, that you want to watch out for. Inflammation is a big one. You know, getting muscle to form is not as easy, even with the hormones. So you might have to watch your intake of protein and vitamin C for collagen formation, stuff like that. And recovery. Recovery isn't quite as easy, even when you do have the hormones in place. Yeah. There are other factors other than, you know, hormones in terms of aging. So some things to avoid maybe that I should, you know, hopefully help her out with an answer to the question. Or, you know, overtraining could be a bigger issue as we get older. Because
your ability to recover is not as good as it used to be.
Yeah, so just because you have the hormones back, don't necessarily get frustrated. I'm not saying, you know, pull in on the reins necessarily until you see signs of it, but just be aware that you know, you might start to need at some point that extra day in the week of rest. to stay the same. I know it seems kind of counterintuitive, but it actually works better as we get older to rein it in just a little bit.
You're a huge believer in glutamine as well. You love glutamine. Right?
Yeah.
For recovery.
Well, and as believer implies faith. You know,
Yeah.
this is science.
Yeah.
Glutamine has been around, been proven for a long time. I at the hospital at which I worked, fought for a good year to get glutamine on the formulary because we know it heals epithelial tissue really, really well. It's great for growth of tissue. So, yeah, that was a no-brainer, especially the oral form because it also helps. One of the things that any athlete faces is having to eat enough food, and it really taxes the GI tract.
Right.
So it helps repair the tissue in the GI tract, so definitely orally. I know they make an injectable is why I mentioned it. But,
Okay.
I think much better is to do it orally because you get sort of a double benefit. Yeah.
Very cool. Thanks, Todd.
Sure.